So another important topic is microalbuminuria. Very, very important topic. Microalbuminuria. So that is the valid risk predictor in diabetes patient. Valid risk predictor. If you break down microalbuminuria, micro means smallest albumin, which is going to present in the urine, which is going to pass through the urine. That is microalbuminuria. So normally, albumin stay in the body. There is little or no albumin in the urine sample. Why? There is a scientific reason. If you'll see, the size of albumin is larger than the pore size of woman's capsule, though albumin is not going to pass out through the woman's pores. Why? Because both having same charge. In same charge, there is a repulsion. But in the case of disease condition, the charge nature of the albumin is and the woman's capsule is going to change. So there is a opposite charge nature. So what happens? In opposite charge nature, the molecules is going to attract. That's what albumin is going to pass out through the woman's capsule. We are getting in urine. That's what. So normal albumin level in the urine are less than 30 mg per 24 hours. That means per day. Microalbuminuria is the presence of a slightly high level of albumin in the urine. So persistent albuminuria means that the kidney has some damage. If there is albuminuria, persistent albuminuria, that means that indicate kidney has some damage. So that is the indicator here. And the microalbuminuria will develop into the macroalbuminuria. That means micro is going to convert into the macro with progression of disease. That means the disease is going to progress. The macro means minor concentration is going to convert into the major concentration of albumin, which is going to present in the urine. So it ranges between 330 to 300 mg of albumin per 24 hours. For that is microalbuminuria. If the value is less than 300 mg per day, so that is microalbuminuria. If the value is equal to more than 300 mg of albumin per 24 hours or per day, that means that is nothing but the macroalbuminuria. Micro means below 300. Macro means more than 300. Microalbuminuria, that is describe a moderate increase in the level of urine albumin occurs when the kidney leaks a small amount of albumin into the urine. In other words, when there is an abnormal high permeability of albumin in the glomerulus of the kidney, as I already told you that in disease conditions, the charge nature of woman's capsule is going to change. So what happened? The molecules of albumin and the woman's capsule charge nature is opposite. So what happened? The molecules is going to attract towards the woman's capsule. So what happened? That albumin is going to pass out through the urine. So normally the kidney do not filter albumin. So if albumin is found in the urine, it's then a marker of kidney disease. That is the indicator of kidney disease. So In early stage, if you are going to find out, so that is the predictor. That means nephropathy is going to start there. So normal urinary albumin excretion is less than 20 microgram per minute or less than 30 mg per 24 hours. Less than 30 mg. That is the normal. If it is 30 to 300 mg per 24 hours, that is microalbuminuria. If it is more than or equal to 300 mg per 24 hours, that is macroalbuminuria. So keep in your mind, if you are taking 24 hours of sample, the lower limits should be 30 and upper should be 300 mg per 24 hours. That is 30 to 300 mg per 24 hours. If you are taking short time urine collection, you are not going to prefer 24 hours. That means the value should be 20 to 200 microgram per minute. But generally, we are going to prefer 24 hours urine sample. Coming to the associations or indications. So markers of vascular endothelial dysfunction, an important prognostic marker for kidney disease. Too much important prognostic marker. That means if the value is more, the prognostic value is less. That is poor progress. If the value is less, the prognostic value is high. That means good progress. In the condition like a diabetes mellitus, hypertension, post-streptococcal glomerulonephritis. So increasing microalbuminuria during the first 48 hours after admission to the ICU. During ICU, the patient is admitted in ICU. So during first 48 hours. So that is the predict the elevated risk for acute respiratory failure, multiple organ failure, and overall mortality. That's what in ICU we are going to measure this HbA1c. A risk factor for venous thromboembolism. So that is also a risk factor for venous thromboembolism. So what are the causes of macroalbuminuria? There is a modifiable and non-modifiable. Non-modifiable, there is a ethnicity and race, male gender, old age, low birth weight, whereas modifiable and well proven, diabetes, uncontrolled diabetes, hypertension, obesity, smoking, these are the well proven cause for the microalbumin. Whereas likely those the individuals who have taking a high salt diet, high protein diet, hyperlipidemia, fever, exercise, chronic heart failure, UTI, vaginal discharge, and all these are likely for the cause of microalbuminuria. Here the causes is renal diseases, diabetes mellitus, cardiovascular diseases, immune diseases, other factors such as strenuous exercise, and all these are the causes of microalbuminuria. See the mechanism here, how microalbuminuria is occurred. Here cardiovascular diseases, due to that, it's like a hypertension, so there is a chances of microalbuminuria, metabolic disorder like hyperlipidemia, then atherosclerosis, diabetes mellitus, that is also cause of atherosclerosis. Then finally, that is going to convert to the microalbuminuria. Whereas immune diseases, here is due to that hypersensitivity reactions. So type 4 hypersensitivity reactions, autoimmune diseases after respiratory infections. So that is also the cause for the microalbuminuria. And renal diseases, that is also. So these are the mechanism of microalbuminuria. So other causes, yes, albuminuria is not as specific for diabetes, It may also be associated with the hypertension, high blood pressure, some lipid alterations, and several immune disorders. So elevated results may also be caused by vigorous exercise. Those who are gymer, they are regularly doing exercise, so we'll get quite high value of microalbumin. Blood in urine, UTI, dehydration, and some drugs have a side effect. So these are the causes of microalbuminuria. And we are going to measure microalbumin in our lab. There are different methods for the measurement of microalbumin. So latex agglutination is one of the method. That is nothing but the nephelometric technique. So immunoassay technique, we are going to measure microalbumin. Nephelometry nowadays in lab, we are going to use this technique through protein analyzer. So I can do to prevent microalbumin. If you are getting microalbumin, so what happens? You can manage. Yes, if you are diabetic, control over your blood glucose level. So first our target should be how to maintain blood glucose within the narrow range. As I already told you, there are two methods. There are two first line of treatment. One is dietary modifications. In that, we have to prefer healthy diets. So we have to prioritize fiber-rich diet. We have to prioritize unsaturated fatty acids. We have to prioritize fiber-rich diet. So we have to restrict refined sugar and all these things. We have to restrict saturated fat. Saturated fat. That is not good for health. Keeping high blood pressure under control is also effective in preventing kidney damage that leads to microalbuminuria. So if you have altered blood pressure, we have to maintain within the narrow range through dietary modifications, like we have to prevent salt, we have to take water properly in summer season. Some studies have shown that those who have albuminuria can prevent it from worsening or may reverse it with good glycemic and blood pressure control by quitting smoking. Some research says that the individuals who have confirmed where that albuminuria and glycemic index is high, if there is a blood pressure is high, those individuals, if they quit the smoke, the person can revert into the normal. So that is also one of the best way. So say goodbye to the smoking. Coming to the stages of nephropathy. So the value interprets the nephropathy. If the value is below 30 mg per day or 2 mg per millimole, so that is the normal. If the value is 330 to 300 mg per day, so that is microalbumin. You will get negative in dipstick. When you will dip the stick into the urine, if the value is up to 300 mg, so you will get the negative. So that is microalbumin, hidden albumin. If the value is 300 mg to 1000 mg per day, so that is overt nephropathy. That is macroalbuminuria. So this is the positive. We'll get positive according 1 plus 2 plus 3 plus 4 plus like that. So overt nephropathy is there, and too much life threatening condition. So you have to respect your kidney. You have to maintain your healthy weight. We have to maintain your lifestyle. You have to maintain your you have to modify your dietary pattern. So this is all for today. If you have any questions, you can ask me.